Both Fresno Survivors of Suicide Loss and Hines Hospice have been serving our community for over 35 years. A little over 3 years ago, Fresno Survivors of Suicide Loss had to make some changes and was no longer going to be able to operate in the manner they had been. It was at that time that Hines Hospice Center for Grief and Healing adopted the Fresno Survivors of Suicide Loss program. The Fresno County Suicide Prevention Collaborative was formed a little over 2 years ago in response to an increased rate of youth suicide. Concerned members of our community came together, working towards goals of decreasing suicide rates, educating our community, and supporting those who have experienced a death of a loved one by suicide. Through the collaborative, several initiatives were identified, and one being the formation of a LOSS team. LOSS stands for Local Outreach for Survivors of Suicide. The team is made up of both a clinician and a survivor of suicide loss. The primary goal of the team is to offer hope and to offer resources. Research indicates that when a LOSS team is in place, the average length of time for a survivor to reach out for support is approximately 45 days. Yet, when there isn't a response by a LOSS team, the average time to reach out for support is 5 years. The LOSS team will respond to the suicide deaths and will be dispatched out by first responders. For those of you that are survivors of a suicide loss, know that we are also here for you, even if there wasn't a LOSS team in place. We offer extensive services here at the Center for Grief and Healing at Hines Hospice to include support groups, individual and family counseling, and events and workshops to help you on this journey of grief. We welcome you to call for any questions or needed support. You can reach us at 322-5877.